Good morning and good afternoon. My name is Kelly Halovsky, and I'm a Policy Fellow at APHA. Thank you for joining us for today's webinar, Housing as a Human Right. When we first envisioned this webinar series, the topic of housing quickly rose to the top of our list. We've been working on a report which has recently been released titled Creating the Healthiest Nation, Health and Housing Equity. This report outlines the historical policies and practices that were intentionally designed. I'd like to repeat that. These policies were intentionally designed to keep people of color and those with physical and mental disabilities out of certain neighborhoods. A main goal of our report was to outline these racist structures and empower readers from the public health community and more broadly to actively participate in redesigning anti-racist, affordable, safe, and accessible housing. We could not have imagined, though, how extremely relevant housing equity would become this year, given the impact of the pandemic and economic crisis. As we all have read and possibly experienced in our professional work and personal communities, these dual crises have exacerbated health and housing equity issues for the impacted groups that we discuss in our report. Now, redesigning safe, affordable, and equitable housing options is even more urgent, as estimates indicate that between 29 to 40 million renters may be at risk of eviction by the end of the year. And Black and Latinx communities account for approximately 80% of that population. Therefore, we are grateful for your participation today and your attention to this critical topic. It looks like we have almost 1,000 participants now, and we are delighted to present a panel of experts that will build from our report and provide you with examples of how to advance racial equity through housing by sharing research and local and federal policy action. Next slide. Before I hand it over to today's moderator, I want to go over a few housekeeping items. Closed captioning is available for our webinar, and instructions for accessing closed captioning have been sent through the chat. This webinar is being recorded, and all registrants will receive a follow-up email with a link to the recording and slides, which will be posted on APHA's website within the next week. Additionally, today's webinar has been approved for 1.5 continuing education credits for CHES, CNE, CME, and CPH. And none of the speakers have any relevant financial relationships to disclose. If you would like CE, you must be registered with your first and last name and participate for the entire webinar. All registered participants will receive an email within a few days from cpd@confex.com with information on how to claim credits and relevant deadlines. We will take questions at the end of all presentations, and you can ask a question by entering it into the Q&A function. For your awareness, the chat function has been disabled for participants and will only be used for announcements. At the end of this webinar, you will be redirected to a survey. Please take a moment to fill out this 2-minute questionnaire to help us improve our future webinars. Finally, next slide, follow the conversation on Twitter using our hashtags racism or health and APHA webinar. Finally, next slide, I'd like to cover some meeting norms for this webinar. We invite you to stay curious, lean and breathe into discomfort, as some of these topics may be difficult for those of you on this call. Inquire to learn rather than to demonstrate knowledge. Avoid playing devil's advocate. Learning and unlearning goes beyond this webinar. And please refrain from immediately reaching out to BIPOC colleagues to discuss this webinar. Take time for your own reflection and reckoning. If and when you do reach out, please get their consent to discuss. And now I would like to introduce today's moderator, Adrian Todman. Adrian is the CEO of NARO, the National Association of Housing and Redevelopment Officials. Before joining and leading NARO, Ms. Todman served as the Executive Director of the District of Columbia Housing Authority from 2009 to 2017. Prior to her tenure at the DC Housing Authority, Ms. Todman served as a policy assistant in the Office of the Secretary at HUD and as a legislative director in the U.S. House of Representatives. Ms. Todman serves on Brookings Housing as a Hub work group. She served as vice president of the Council of Large Public Housing Authorities, is a trustee with the National Housing Conference, and was also named a Woman of Influence by Housing Wire. She is a graduate of Smith College. I'll now turn it over to you, Adrian.
Thank you very much, Kelly. And good morning and good afternoon to the over 1,000 of you who have joined us this afternoon or today. Let me tell you a little bit about what's going to happen over the next hour or so. We are going to take you on a journey. And this is not your typical journey. This is a journey that spans generations. This is a journey that in many ways determines all of our well-being and our economic mobility. This is a journey that, sadly, depending upon where you begin, it may determine where you end. And I'm talking about the journey of the evolution of housing in this country. I have been a student of housing for more years than I want to discuss right now. But part of the passion that I have for housing is how critical it is to our everyday life and to the lives of our children and grandchildren. But notwithstanding that, how much we have taken it for granted. I want us all to think back about our own home experience when we were growing up. We don't dwell on it a whole lot. And that's typical, that's okay. Most people don't think about the importance of housing until sadly it is gone or it is being challenged. And it is sad that today, particularly during the pandemic, we are seeing so much housing insecurity. We're seeing the need for more affordable housing. We've had years now of living inside of a housing crisis that is only exacerbated with what has happened this year. So this is going to be an amazing afternoon filled with opportunity and information and data to help you understand this journey that is housing, not just for us individually, but throughout the years and throughout history, and also what we can do about it. I want to share one quick example of why housing is just so important and the importance it has, and a story that stuck with me for many years. There's a gentleman by the name of, I'll call him Mr. Strong, I won't divulge his first name, who I met years ago when I was a director of the Housing Authority, who was a homeless veteran. When Mr. Strong approached us for housing, he had a wonderful military career, had put 2 children through college, had a home, had a job. And with the loss of his job, it began a vicious cycle, a spiral that led him to live on the street. When he approached the agency for assistance, he was living in a van with some other homeless vets. We were able to provide Mr. Strong with a housing voucher. We were able to stabilize him. And through the years, he has thrived. His third child, who he had been separated from, was returned to him and finished high school, and I believe now is in college. Mr. Strong himself returned to school and began law school. I've lost touch with him. I'm not quite sure if he's completed. But the last time I saw him, and here we are right here, if you can see us, I was so proud. I was so proud at how far his journey had taken him. But that journey would not have occurred without the stability and the safety of a good home. Today, we're going to be joined by some wonderful They all happen to be ladies who are going to share with you some really important information about the way that we look at housing now and how far we have come and how far we have to go. We will begin with Dr. Camilla Wood, who I happen to have known for some years. Dr. Wood is a community pediatrician and public health practitioner with deep experience in leveraging cross-sector engagement to advance health equity. She formerly served as the Senior Vice President of Health and Housing at Stewards of Affordable Housing for the Future, working directly with housing developers to improve the outcomes of marginalized communities. And she also served as a White House Fellow and Special Advisor to Secretary Anthony Foxx at the U.S. Department of Transportation, advising senior leaders on the intersection of health and transportation. Dr. Wood, the floor is yours.
Thank you, Adrienne, for that wonderful introduction. And thank you to the American Public Health Association for the invitation to participate today. Really excited about today's webinar and this opportunity to engage in a very important dialogue. So just a couple of pieces of what I'm going to talk to you about today and hopefully framing the conversation for the presenters that I'm so honored to be joined by today. A couple of things we'll quickly go through. We'll briefly review the link between health and housing outcomes and the data that's out there. We'll talk a little bit about housing stability and affordability inequities, drilling down into some of the data. And then we'll discuss the root cause of housing inequities and historical policies that reinforce this existence, and even policies that exist today that continue to perpetuate systems of oppression. So I'm sure folks on this webinar are familiar clearly with the intersection of health and housing, and there's quite a bit of data out there that really validates the importance of having a stable, healthy home and improving health outcomes. We know this from environmental exposures, from substandard conditions that can impact everything from your respiratory health with asthma to your mental health, but also toxin exposures, noise, and injury hazards, and safety and overcrowding all playing a deep role in impacting health outcomes. We also know housing affordability is a huge issue. It actually has a direct connection to a child's cognitive achievement, as well as the stress of experiencing housing instability and what that does to the physical body and the person's ability to achieve health and well-being. And finally, there's definitely a connection in the community context, understanding the importance of community connectedness in health outcomes, the role that concentrated poverty has on health, and obviously access to other social determinants, including healthy food, transportation, and high quality education, all play a role, and the data has really showed the connectedness between these two sectors. So let's talk a little bit about the disparity around housing affordability and stability. There's a disproportionate impact on communities of color, with Black and Hispanic renters experiencing a higher rent burden. Just over 31% of Black renters and 28% of Hispanic renters experience a higher level of their income that they spend on their rent. They're also experiencing higher eviction rates. And as we opened with, we know that all of this has been exacerbated by the COVID-19 pandemic, but a lot of communities were entrenched in these issues well before the pandemic hit. We also know that there's lower rates of home ownership among Black and Hispanic communities. We know the importance of having financial assets. When we talk about health and wealth and having that economic mobility is incredibly important, and home ownership is a part of that. And there's a much lower rates for community of color. Black households are also more likely to live in older, crowded, or substandard homes, and also more likely to experience homelessness. And we know that this is not, obviously doesn't happen in a vacuum. And with these kind of issues around housing affordability and stability, there's a cascade of other financial and social hardships that people experience. So oftentimes when we have this conversation, sometimes I've engaged in dialogue with colleagues where we kind of stop there, but I love what this webinar is really helping us to look at is really the root cause of this and why does this happen to begin with. And really, this is a proxy for structure and systemic racism and the generations of historical oppressive policies that have really marginalized communities of color. So before we kind of dive into what that looks like in real policy terms, I just wanted to take a moment to reflect on the difference of race versus racism as a social determinant. And I know I'm sure this has come up in some of the previous webinars, but wanted to set the stage as we engage in this dialogue today. Race is really a social construct, not based in biology. And what we're talking about that has the greater impact is racism. So defined here as the prejudice, discrimination, or antagonism directed against someone of a different race based upon a belief that one's own race is superior. And as I'm sure many people are aware, this shows up in a variety of different ways. It can be individual, internalized. Where we'll be focusing today is really on this systemic and institutional racism that communities experience. There's a couple of quotes that I really love that help to highlight this and bring this to light. One is from Robin DiAngelo from her book, White Fragility, which I'm sure folks are familiar with. When a racial group's collective prejudice is backed by the power of legal authority and institutional control, it is transformed into racism, a far-reaching system that functions independently of the intentions or self-images of individual actions. And from Ta-Nehisi Coates, but race is the child of racism, not the father. So I think that distinction is important as we talk about particularly these systems of oppression and systemic policies that really codified racism and how we do business in a lot of different ways, and particularly in housing policy. So let's dive into redlining. Again, I think particularly with the COVID-19 pandemic, it's been interesting for this history to bubble up more and understanding the root cause of segregation, but wanted to talk a little bit about it in deeper detail. And the biggest part of this that I want to highlight was that this was a federal policy. This wasn't an individual's decision to do this. This was codified in the way we were doing business. And it was a policy that facilitated the discriminatory pattern of disinvestment and obstructive lending practices to people of color. In this slide, you'll see on the right-hand side an actual description that was used when redlining was a part of our policies that described the racial makeup of neighborhoods that helped them to make this decision about what the quality of this neighborhood was, and they graded neighborhoods based upon that. So if there were more Black people in the neighborhood, it was defined as the lowest grade, which was D, which was hazardous. And so neighborhoods with minority occupants were marked in red and considered high risk for mortgage lenders regardless of individual creditworthiness. So this excluded Black families from obtaining mortgages and were subject to predatory lenders. So again, this construct really deemed communities of color less valuable and had a cascading effect that we see now even in today's generation. So that has really led to a lot of the wealth and income inequality gaps we see today, the persistent segregation and the inequitable distribution of resources in communities of color, which I know folks are familiar with. And you know, in our public health communities, so much of when we say zip code is a greater predictor of health than genetic code, this is what we're talking about. This is the root cause that really leads us to that very kind of catchy phrase, and something that I think it's important to keep in mind. So that particular document was from Richmond, Virginia, and this slide gives you the map that was accompanied with that, and that's on the left-hand side. So again, that different redlining policy gave a color-coded grid to help to describe what they deemed the quality neighborhood. Those that were labeled hazardous, D, are represented here in red. And then as you kind of go along the scale, it goes from red, yellow, blue, and green. Now on the right-hand side of this, you'll see this life expectancy map, which I'm sure folks are very familiar with, that was done with Robert Wood Johnson Foundation. You even have some transportation policy here that you're seeing with the highways segregating communities. And obviously these two maps are not drawn to scale, but there is some overlap here when we're talking about the life expectancy and where people live. So again, this is not by accident. This is not by anyone's personal choice. This is really deemed in the policies that this country has really embedded in how we do business with housing policy in the past. And I think this really helps to illustrate that. Redlining was accompanied also by other policies that really helped to hyper-segregate communities, one of which was exclusionary zoning and land use. So this came up as a part of the United States policies in the early 1900s, and it helped to shape the built environment and stabilize land values. That was kind of the general ideal of bringing these policies to life. However, it also became a proxy to segregate communities and embedded social objectives. Now, this quote that I have here, which I'll read, I think is important because these were policy decision makers who were using this language and were embedding these biases in how they did business. And really, again, that's what we're still seeing the reverberation today. This is from Baltimore Mayor J. Barry Mahul in 1910. I did very light research on this mayor, but in this time, he was actually considered to be pretty progressive and on what we would probably consider to the left and what his political standings and thought was. And here is his quote. Blacks should be quarantined in isolated slums in order to reduce incidents of civil disobedience, to prevent the spread of communicable disease in the nearby white neighborhoods, and protect property values among the white majority. So clearly this quote has several racist ideas, and this political figure really saying this and edifying this in the way they did policies really has a strong qualitative element in addition to how they did the policy work then and what we're even seeing today. This picture that I have on the right-hand side is from 1923 in a Minneapolis paper advertising a new development and really calling on folks who want to move into this new development and advertising it. What they don't note in here is that there were also racial covenants tied to property and real estate. In other words, there would be deeds that would say, do not sell this property to Black people. And there are a lot of work in different municipalities right now who are actually trying to undo this work, but these racial covenants have helped to segregate communities as well when folks were even doing new development. So what is the legacy of segregation and this housing injustice as we look at these policies today? There's a lot of discussion, I'm sure, in different communities that people have been familiar with this kind of NIMBY movement, this not in my backyard, where people may not want affordable housing properties built in their particular neighborhood or in their community. Unfortunately, I think some of this rhetoric has been inflamed recently and thinking about where people live, but this in itself can often embody racist ideas and thinking about what it means to have an affordable housing property in your neighborhood that brings a negative light to it. That is really marginalizing to communities. The Trump administration has also been working pretty hard to repeal HUD's affirmatively affirming fair housing rule, or AFFH, because that's a mouthful, much easier to say. But this rule was a part of the Obama administration in 2015 that helped to enforce elements of the Fair Housing Act of 1968. And what it did is gave guidance to different housing municipalities to be able to look at communities, assess where segregation may have happened, and developing a plan to really address it. Anything segregation, discrimination, this rule helped to enforce that. And the Trump administration has really been trying to roll that back since January 2018, and more recently this summer has been discussions of repealing it altogether and replacing it with something else. But obviously a rule that's really proactive in trying to undo some of the segregation and racist policies that were embedded in the system was really critical as a part of AFFH, and there's been an attempt to roll that back, and that's very concerning for policy and decision makers on the ground moving forward. Also a more current policy that people are keeping their eye on are opportunity zones. This is a tax policy that was a part of a tax bill back in 2017 that was really intended to help drive investment into low-income communities where different investors may not would have otherwise not opted to do so. However, it's very complicated. I do not prescribe myself to be an expert in any shape or form, but I know there's been significant controversy about it and concern that it only benefits wealthy investors and that there are ways in which it can drive gentrification and whether it even meets the mark of actually driving income into low resource or low income communities. So even then, these are policies now that I think policymakers are really trying to keep their eye on and ensure that there aren't either explicitly or unintended consequences as a part of this work. So I'll end with this slide. I think, I really appreciate the kickoff of this conversation as we talk about the intentionality of these policies and what it did to communities. I often have these conversations with folks where people say the system is broken, the system is broken. I'm like, the system is not broken. The system is doing exactly what it's set up to do. So as we think about policy solutions and other ways to engage to really undo this, it's really important to keep that in mind and thinking about these structural and system elements and actually how can we begin to dismantle that to ensure that we're really creating a place where everyone has access to a healthy, affordable home so that they can thrive. Excuse me. So I'll stop there and turn it back over to you, Adrienne.
Thank you very much, Dr. Wood, and what a powerful beginning to this conversation. And thank you not just for creating the link between housing and health, but really taking us backwards and looking at some of the built-in inequities and that was built into the system and bringing that forward. Thank you so much. We'll now be joined by Ms. Kim Johnson. Kim is a policy analyst at the National Low-Income Housing Coalition, one of our sister affordable housing organizations here in DC. There, she handles the coalition's policy portfolios related to appropriations, reentry housing, evictions, and housing protections in the Violence Against Women's Act. That's a lot, Kim. Before joining the coalition in July 2019, Kim worked with Stewards of Affordable Housing for the Future, the Senate Minority Health Committee, and held a fellowship with the National Network to End Domestic Violence while pursuing her master's degree in public policy from George Washington University. Ms. Johnson, if you are ready, take it away.
Oh, sorry. I was having trouble finding my unmute when I was in full screen for my
very
presentation.
Good.
oh my goodness. Hi, everyone. And thanks so much, Adrian, for that lovely introduction. My name is Kim Johnson. I'm a policy analyst at the National Low Income Housing Coalition, or NLIHC. NLIHC is a nonprofit dedicated to achieving socially just housing policies that ensure the lowest income people, including people experiencing homelessness, have safe, stable, accessible, and affordable housing. During my presentation today, I'm going to share how the national shortage of affordable, accessible housing available to the lowest income people disproportionately impacts marginalized communities, and how the pandemic has exacerbated longstanding issues of inequity. I'll also discuss what federal policies have been enacted to provide relief to struggling renters and what more needs to be done to ensure people are able to remain safely, stably housed, both immediately and in the long term. Even before the COVID-19 pandemic, the country was in the grips of a pervasive affordable housing crisis. Nationally, there is a shortage of approximately 7 million homes affordable and available to the lowest income renters, and there is not a single state or congressional district in the country with enough affordable homes to meet demand. Across the country, the greatest need for affordable housing is concentrated among extremely low income or ELI renters who earn no more than 30% of area median income. Only 4 million affordable and available rental homes exist for the nation's 11 million lowest income renter households, assuming they spend no more than 30% of their income on housing costs. The national shortfall of 7 million homes, affordable and available to ELI renters, accounts for virtually the entire shortage of affordable homes in the US. When ELI households cannot access affordable homes, they must compete with higher income renters for housing that they cannot reasonably afford. As a result, 11 million renter households are severely housing cost burdened, meaning they spend more than half of their income on rent and utilities every month. And 8 million, nearly 3/4 of severely housing cost burdened renters, are extremely low income. The majority of ELI households are people who are in the labor force, seniors, people with disabilities, people in school, or single caregivers. Housing cost burdens make it more difficult for extremely low-income households to accumulate emergency savings. And without savings, unexpected costs like car repairs or unreimbursed medical bills or a drop in income can cause households to fall behind on their rent and face eviction. The housing instability caused by eviction can lead to significant disruptions in critical services and economic stability. For example, a lack of stable housing can disrupt the care given to chronically ill individuals, interrupt student learning and academic achievement, and increase the likelihood of a job loss. Affordable housing and housing subsidies are foundational to employment, economic security, and positive health outcomes. Another fundamental problem is the mismatch between what people earn and what housing costs. Since 1960, renters' incomes have increased by 5%, while rents have risen 61%. High rental costs and low wages leave housing cost-burdened renters with few resources to cover other necessities like medical care or nutritious food, and put them at risk of housing instability and, in worst cases, homelessness. NLIHC's research report Out of Reach, the High Cost of Housing, estimates each locality's housing wage, which is the hourly wage a full-time worker needs to earn to afford a modest apartment without spending more than 30% of their income on rent. In 2020, the national housing wage was $23.96 per hour for a 2-bedroom apartment and $19.56 per hour for a one-bedroom rental. The average minimum wage worker must work nearly 97 hours per week, more than 2 full-time jobs, to afford a 2-bedroom home, or 79 hours per week to afford a 1-bedroom unit at fair market rent. While housing wage varies from state to state and county to county, in only 5% of all US counties can a full-time minimum wage worker afford a 1-bedroom rental home at fair market rent. And Black, Native, and Hispanic households are disproportionately represented among ELI renters. White households account for 65% of all US households, 50% of all renter households, and 43% of extremely low-income renters. Black households account for 12% of all households, yet account for 19% of all renters and 26% of extremely low-income renters. And Hispanic households account for 12% of all US households, 19% of all renters, and 21% of extremely low-income renters. As Dr. Wood discussed, Black, Latino, and Native households have faced decades of ongoing racist discrimination in not only accessing affordable housing, but in accessing tools to build economic security. These longstanding issues are part of the foundation of racial differences in health outcomes, poverty rates, involvement with the criminal justice system, housing affordability, and homelessness. And that's all before the pandemic hit. The coronavirus pandemic has magnified and accelerated the affordable housing crisis. As of September 2020, 60 million Americans had filed for unemployment, and over 20 million renters lived in households that have suffered coronavirus-related income loss. Millions of households are struggling to afford rent, and without federal action, an estimated 30 to 40 million people will be at risk of losing their homes by the end of the year. As Dr. Wood said, Black, Hispanic, and Native people have been disproportionately impacted by the pandemic and bear the brunt of coronavirus infections, fatalities, and coronavirus-related financial stress. 44% of Black households, 63% of Latino households, and 46% of Native households report an adult household member lost their job or experienced reduced wages or hours because of COVID-19, compared to 42% of white households, which in some cases is not significantly different, but it's when we look at the broader ramifications of reduced wages and job loss that we see the disparities really start to stand out. So 60% of Black households, 72% of Latino households, and 55% of Native households reported serious financial problems, compared to 36% of white households and 28% of Black households, 32% of Latino households, and 25% of Native households reported difficulty paying mortgage or rent, compared to 15% of white households. Extremely low-income households, who again are disproportionately Black, Latino, and Native, experiencing financial strain, are less likely to have savings to fall back on and more at risk of eviction. Having even one eviction on record makes it more difficult to find another home, and in worst cases, evictions can lead to job loss and homelessness. In response to the ongoing pandemic, the CDC enacted on September 4th a federal moratorium on evictions for non-payment of rent, citing the historic threat to public health posed by the virus and noting housing stability helps protect public health because homelessness increases the likelihood of individuals moving into congregate settings, such as homeless shelters, which then puts them at risk of COVID-19. While essential, this moratorium only postpones evictions. When the moratorium expires on December 31st, millions of people will be at risk of losing their homes. Congress passed the CARES Act in March of this year, which included funding for homelessness services and housing instability that has been crucial to helping communities respond to the pandemic. However, additional assistance is urgently needed to ensure that low-income households will not lose their homes in the middle of a pandemic, where our collective health relies on our ability to stay at home. Research shows that at least $100 billion in emergency rental assistance is needed to avoid creating a financial cliff for renters to fall off of when the moratorium lifts and back rent is owed. $11.5 billion is needed for communities to adequately respond to and prevent coronavirus outbreaks among people experiencing homelessness, and $13 billion in additional funding for HUD and USDA housing programs is needed, including creating 100,000 new emergency vouchers for people at risk of or experiencing homelessness. And to maximize impact, these resources must be targeted to communities most impacted by coronavirus. Much like the policies that have led to these disparities were intentionally designed, we also must be intentional in our solutions. NLHC has partnered with other national organizations, including National Innovation Service, the National Alliance to End Homelessness, and the Center on Budget and Policy Priorities to develop the Framework for an Equitable COVID-19 Homelessness Response, which provides guidance to communities on how to use federal funding sources strategically across key public health and economic recovery stages to ensure assistance is being targeted to communities most impacted by COVID. And even while we work to respond immediately to the threats posed by the pandemic, we must also push for policy solutions that will help address the underlying affordable housing crisis that has contributed so heavily to the disproportionate impact of the virus on Black, Latino, and Native communities. We need to work to bridge the gap between income and rent. We must expand, repair, and preserve existing affordable housing infrastructure and establish a national housing stabilization fund to help extremely low-income renters cover unexpected costs that put them at risk of eviction. And we must work to expand and strengthen fair housing protections. All of this must be done with a focus on targeting resources to communities and households that have been historically disenfranchised and who are most impacted by the pandemic. And this is my contact info. I will be happy to take questions during Q&A, but for now, I'll turn it back over to you, Adrienne.
Great. Thank you very much, Ms. Johnson, and thank you for offering a presentation so rich with data. The coalition does a phenomenal job using that data to advocate for not just increasing the housing supply, but certainly preserving public housing and advocating for more housing vouchers, as you just laid out, and certainly the need for rental assistance for families who are experiencing housing insecurity due to the pandemic. Thank you so much. We look forward to answers to your questions. Next, we're joined by Dr. Amelie Ramirez. Amelie is an internationally recognized health disparities researcher at University of Texas Health San Antonio and a member of the National Academy of Medicine since 2006. Dr. Ramirez is the chair of the Department of Population Health Sciences and founding director of the Institute for Health Promotion Research at the University of Texas Health San Antonio. She is also the MCC Associate Director for Community Outreach and Engagement. Dr. Ramirez has years of experience in conducting behavioral and communications projects to reduce cancer, prove the efficacy of patient navigation for cancer patients, and improve health lifestyles among our underrepresented communities in South Texas and nationally. Dr. Ramirez, the floor is yours.
Thank you so much, Adrienne. It's a pleasure to be here with all of you. What an amazing panel, and it's just a delight to understand that we share a lot of commonalities in terms of the type of work that we're doing. And I'm going to have a little assistance with my slides, so we can go to the next slide. I wanted to share with you a little bit about who we are in terms of Salud America, and then, really focus in, you've heard a little bit already in terms of some of the disparities we're seeing in housing with the Latino community, but my presentation will specifically focus on some of the challenges that we're seeing here, then maybe some possible solutions and some of the next steps. The next slide, I just wanted to share with you a little bit about Salud. Salud is a program funded, Salud America is funded through the Robert Wood Johnson Foundation, and we've started focusing on child inequities and childhood obesity, and now we've moved more into health inequities in general among the Latino population, with a strong focus on the health determinants of health. But most of all, I wanted to share with you all a point that, almost 80% of the nearly $3.5 trillion that we spend on medical care each year in the United States is spent on treating chronic diseases. But all of these diseases are related to conditions to where we live, learn, work, play, and even age. And some of these issues have been mentioned by our two previous speakers, but housing impacts our economic stability with regards to poverty, jobs that would actually pay for sick leave and those kinds of things. Our neighborhoods, in terms of, do we have safe streets? Do we have green places to play with where our housing is located. And then also social cohesion, you know, the issue of racism that was brought up earlier by Kamala, discrimination, and then also immigration and the issues that we're facing there. And then with regard to health, not only are we looking at traumatic situations that are happening in all our communities, but also issues dealing with obesity, access to primary care, and then access to maternal and mental health care. And last but not least, education. You know, education is an equalizer for all of us. And so we really need to focus a lot of attention on early education from, you know, preschool all the way through graduation and through graduate school. We have this whole continuum of education that we need to focus on. But all of these issues are truly connected to where we live, into our housing conditions. And so, you know, Salud America is really a social media outlet where we have been curating content based on research to get the issues reflected with our Latino community. Latinos now are the largest minority population in the United States, representing 18.5% of the US population, but oftentimes their issues go unrecognized. So Salud America is a national Latino-focused organization that creates culturally relevant and research-based stories, videos, and tools to empower and inspire our people to start and support healthy changes to policies, systems, and environments where our Latino children and families can equitably live, learn, work, and play. As of 2017, our Salud America network was over 200,000 members strong, and we combined email networking and social media. This network has grown to over 400,000 after the pandemic struck, because we really began curating quite a bit of information on how COVID was disproportionately impacting on Latinos. Our vision is to create culturally relevant multimedia research and tools and stories to activate people to start and support policy and system and environmental changes in our schools and in our communities. And in terms of the next issue, focusing on housing among Latinos, we can go to the next slide. We have developed a very detailed brief that I encourage you who are interested in this issue to go to our website, saludamerica.org, to gather this information. But we developed these in-depth briefs on housing affordability and how it affects financial stability, stress, and ability of Latino families to make healthy decisions. Our children are our Latino children facing housing insecurity, had families that were more likely to get behind on their rent payment, as was mentioned earlier, during the past 12 months, and more likely to have to move twice during the last 12 months. And these children are having a history of homelessness and are more likely to be hospitalized or have fair or poor health issues at some point in their life, compared to those who have not had to deal with housing security issues. On the next slide, the percent of Latinos who are housing cost burden grew from 42% in 2000 to over 57% in 2015. Latino home ownership have decreased each year from 2014 to 2017, meaning that more Latinos are renting their homes. And over half of the Latino households, about 54%, were renting their homes in 2016, compared to 28% of non-Hispanic white households. The rate of Latino renters forced to move involuntarily was significantly higher than for non-Hispanic white renters in one study. We know that eviction has harmful consequences, such as involuntary displacement, disruption of social networks, risk of moving into substandard housing, dangerous neighborhoods, long commutes, homelessness, more physical and mental risks, and prolonged trends of moves that break social cohesion. These are things that we need to seriously take into account. We also find that the involuntary displacement can cause Latinos to lose social networks and a cultural base. In one study, the rural gentrification of urban whites seeking more natural settings or convenient golf courses moved into two Latino communities. One was a Virginia town of about 96,000 and another a Georgia town of 16,000. But what happened is that this drove up housing costs, and even though which was good maybe, but it also created low wage opportunities for workers. But these workers were no longer able to afford the housing that they had in their community as they were moved out and were forced into kind of employer furnished housing and transportation. So what can be some of our solutions to this situation? On the next slide here, we talk about cities and communities can partner and increase pushing more affordable housing using tools like eased zoning standards, buying land to give to affordable developers, and setting up affordable housing trust funds for future projects. Cities are also putting these issues of affordable housing up to our voters. For example, voters in Austin, Texas, with a Hispanic population of 34.5%, approve municipal bonds for affordable housing projects. Voters in Charlotte, North Carolina, with about a 14% Latino population, approved affordable housing trust and an ongoing public funding source for low-income housing and developments. So localities can help keep renters in their homes with rental housing assistance or repair programs. For example, in 2009, Milwaukee tenants facing eviction were given access to emergency housing aid from the American Recovery Reinvestment Act. The city's formal eviction rate fell by 15% by providing this assistance. Regardless of the merits of their cases, tenants with legal counsel are much less likely to be evicted than those with a lack of representation. So establishing publicly funded legal services for Latinos and other families in housing courts could prevent the long-term negative consequences of eviction, decrease homelessness, and help limit discrimination in evident decisions. And I don't know if some of you just recently heard a newscast this morning on ABC News where a family was just getting their house appraised, and one appraiser noticed that there were African-American family photos there, and the person living in that home happened to be a lawyer, and she suspected something, and so they went and they removed all of their photos and had a second appraisal, and that second appraisal for the same house gave a higher appraisal. So these are things that are happening in our community, and we need to really focus on creating change. And again, the housing eviction and these situations and not being able to afford the rent as has been stated earlier, has really been over exemplified with the issue of our pandemic. Another potential solution on the next slide is how can these developments improve affordable housing near public transit so that our residents can easily get to their jobs and other amenities. Just here in San Antonio, we've been looking a lot at the transit issue because of the redlining that we heard about earlier. A lot of the transit systems weren't going as far as they need, and many of our families were having to change multiple buses to get to their destination. So transit-oriented development is a model for neighborhood revitalization, and that, in creating areas that are walkable, that are not as dense, include more mixed-use development in close proximity to high-quality transit. Without maintenance or expansion of affordable housing stock, transit-oriented development projects in Latino communities have been historically detrimental. Thus, an important aspect of transit-oriented development in mixed income housing, which limits the income segregation, allows low-income households easy access to public transit, limits displacement, and enhances community vibrancy, according to a recent review that we completed. Other research solutions that we can see on the next slide is that here are some examples that we can look at. Four common conditions emerged from a study of large-scale transit-oriented developments in 4 low-income neighborhoods in California. One was the MacArthur Park in Los Angeles. The other one was Fruitvale in Oakland, Boyle Heights in Los Angeles, and Logan Heights in San Diego. These communities successfully limited displacement and maintained their Latino identity and satisfied the community's needs and desires. Some examples were building affordable housing. In all 4 projects, neighborhoods united to demand affordable housing. Latino politicians and community groups served as champions for the projects and used their political capital to make sure that the plans were implemented as agreed. And they also supporting or establishing amenities and public spaces with features that were culturally relevant for Latinos. So the Fruitvale development also featured healthcare, childcare, a city library, a senior center, and a chartered high school. The Boyle Heights project created a Latino culture-focused public space to spur vibrancy and created a mariachi plaza that hosts musical festivals, urban farmers markets, car shows, and other relevant cultural events. Investing in community-based public arts was also important to these communities, and also collaborating with activists in their neighborhoods to make the transit-oriented community-oriented. So several neighborhoods and organizations were formed because of these developments. So these are the types of things that we'd like to see to occur more in our communities of color. On the next slide.
Dr. Ramirez, you have less than 1 minute left. Thank you.
Okay. Next slide. Some experts say that raising unemployment could spark a 45% rise in homelessness by the end of 2020, leaving over 800,000 people with no permanent shelter in the United States. Our healthcare officials and social justice advocates need to call on our legislators to consider housing as a necessity. And our next slide, and almost my final slide, is that we also need to understand that racism is a public health crisis. And through our Salud America program, we developed a 3-step action pack that can help you get input from your local advocates of color to start a conversation with your local leaders and to build support for a resolution to declare racism as a public health issue. So we encourage you to go to our website to get this additional information. We can no longer sit around and do nothing. We need your support and we need to create change. So my last slide is just to say thank you so much, and I'll be glad to answer questions at the appropriate time. Thank you.
Thank you very much, Dr. Ramirez. I felt bad interrupting you because you were laying out so many good ground solutions to some of the problems you laid out. Well done, well done. Next, we're going to hear from Ms. Amina Kirk. Ms. Kirk is a senior legal and policy advocate with Detroit People's Platform, a racial and economic equity organization. She received her JD and Masters of Urban Planning degrees from the University of Michigan. Amina has over 10 years of broad advocacy and organizing experience involving affordable housing, equitable development, and racial and economic justice in both the United States and in South Africa. Ms. Kirk, it's yours.
Thank you. So I am here to talk a little bit about the work that I do, but more so the work that we can achieve if we partner together as public health professionals that you all are, and housing advocates and organizers, which are whom I work with. And so we, in my organization, we focus on affordable housing policy issues, and we center racial equity in all of our works. We use a racial equity lens to do our policy analysis and construct our policy proposals, and that also guides our organizing work. So we do community organizing to push for those policies to get them enacted. And in Detroit, which is where we're based, we have had an affordable housing crisis for some time now. It has been ongoing for a while, and it has been, to some degree, the result of actually revitalization efforts that are taking place in the city. There's a lot of money coming in, a lot of investment, and unfortunately, affordable housing is not a priority in the planning and execution of those revitalization efforts. And the result has been some displacement that has taken place. So we work towards equitable development and affordable housing, and we also look at the health and accessibility of the housing stock that we have in the city. As I said, we've been facing affordable housing crisis in Detroit for a long time before COVID-19. Our median income is very low. It's under $30,000 a year. We have very high rent burden, some of the highest in the country. 1 in 5 Detroiters actually face eviction each year, and it's actually a big problem for our entire state. Michigan has a very high rent burden. We are the second highest rent burden in the city, among the largest 100 in the country. And we also have issues with accessibility as far as both our disabled residents not being able to find accessible housing, but also a lack of transportation. We have very poor public transportation, and that makes where affordable housing is actually located very important in order for residents to access education and employment opportunities. So a recent survey that was done in September, we found that 25% of our residents are actually unstably housed, self-reported as being unstably housed. And that is not reflected in what is happening with our funding, our policies, and everything around our development. Mostly we've had a lot of money put into luxury and short-term rental housing development, and not as much money, not nearly enough money has been put into affordable housing, either the creation of new housing or bringing our affordable housing that is naturally occurring up to code. So we have lead paint issues, asbestos, lead pipes. All of that needs significant funding, and we have not had a concerted effort to either fund it or provide the policies that would allow for the funding at a state or a federal level. We also have a large migrant population in the state of Michigan that work, our agricultural workers represent a large migrant population who are often precariously housed. They have housing that is often tied directly to their employer. And so when they encounter job loss or reduction in hours, it can really put their housing at risk very quickly because their employer can, ask them to leave that housing if they are not working or if they need to reduce their hours. So we have had an issue for a long time, and COVID-19 has only made it worse. We're seeing people 4 to 6 months behind on rent, and that was data that was pulled this summer. So those are individuals that may have always been a little bit behind on rent, but with the reduction of hours or loss of income that was caused by COVID-19, things got much worse, much faster. We do have a state eviction moratorium that was put in place during the state of emergency during COVID-19. And of course, we have the federal eviction moratorium that's in place, but it does not cover the late fees that are often the cause of eviction for low-income residents who may be able to put together the money to make the rent payment, but they can't catch up because of the late fees and penalties that are included in their lease. And those eviction moratoriums, either the local, state, or federal, don't account for those late fees and penalties, which really do put low-income renters underwater. So since COVID-19, what we've been working on is we were already working on building a housing justice movement. So we've been working on policy proposals that really organize residents that we've already been organizing around the housing crisis, specifically around the funding and assistance we need to address COVID-19. So that involves adequate housing in non-congregant shelters for our homeless population, that provides for funding to cover those late fees and penalties, so that when those eviction moratoriums expire, what we don't see is an onslaught of tens of thousands of evictions in the city. And then just pushing for a state fund that was created for affordable housing, but it is only funded at $50 million. So pushing for more money for that state fund. So a lot of it, as you hear, is really coming down to funding. And you're going to see that that's a continuous theme that I'm going to talk about, because we do have the data around affordable housing. We do have the information from our on-the-ground organizers, from our affordable housing developers, who can tell us what works for affordable housing. So what we're not in need of is new ideas. We have really good ideas. We have great solutions that have been proposed and created by the impacted residents and those that have worked with them for some time. What we are lacking is a combination of political will and funding, and political will to put policies in place, the political will to push developers, even market rate developers, to include affordable housing in some of their developments. We have an inclusionary zoning ordinance that we were able to achieve
Ms.
some
Kirk?
years ago, but it simply doesn't
Ms. Kirk,
provide.
I hate to interrupt. I think that you might consider, as you go to your next slide, going into the, right now we're seeing your entire slide deck. Go into
Oh, it's not in
go into
share.
presentation mode. Yeah.
All right, give me one.
My apologies for interrupting.
Oh, no apology necessary. Thank you. And if I can. All right, is that any better?
It appears to be better, but we're still seeing your slide deck on the left.
I'm not sure why. I am having, let's see. All right, bear with me. I'm not sure why that's happening, but
be in slideshow mode, Amina, at the top of your screen. There's a tab that says slideshow next to animations.
And the problem is that actually Zoom is like in the way, so I can't get to that toolbar. Let's see if I can do it here.
Yep, from current slide, if you can see that.
Okay, so I tried to just close that that side deck. Can you see the whole thing now?
That looks better.
Okay, my apologies. As we are talking about funding, I want to talk a little bit about the work that that can be done with public health advocates and professionals such as yourself. And that's something that I will try to talk about throughout, is what we can do, because we want to talk about the solutions that are out there. One big thing that we can all work on, and there are organizations that are working on this, and it's been seen as an issue for affordable housing policies and affordable housing initiatives, is the narrative around affordable housing itself. So how do people actually contemplate affordable housing when they think of affordable housing? And there have been studies done, and there's been work done by some national organizations that have shown that people simply don't think that everyone deserves housing. And so that is a big hurdle to overcome when we're talking about creating policies that actually serve the need that is there, and actually giving the funding that is necessary. We in the United States do not see housing as a human right. We do not believe that everyone deserves housing. What we see it as instead is a reward. When you live your life the right way, when you achieve the things that you should, then you get housing as a reward. And the adequacy of your housing, whether or not it fits your needs, is a reflection of your work and what you deserve. And so that's a big hurdle to overcome. And that's a narrative shift project that has to take place, is that we have to, as a country, embrace the idea that housing is a right, and that then we can start to get the policies that we need and the funding that we need. We also have to center racial equity in the creation of housing and in the strategies around affordable housing. And so centering racial equity actually means looking at, as other presenters have spoken about, the past legacy of racism that was used in policies. So oftentimes we hear, people live where they want to live, and communities are a reflection of the desires of the residents that are there. And so we shouldn't try to artificially manufacture racial integration in communities. And that simply isn't true because it ignores the history of the fact that the racial patterns that we see in housing today were actually artificially created. They were constructed in our city planning, they were constructed in our housing policies, in our banking policies for mortgages. And so we've artificially constructed these racial lines of stratification in the way that we live, in the housing that we live in, and our policies then continue that legacy. And so we do have to actually be interveners in that process and step in to undo it, because if we don't, it will only continue because the system's been set up in this way and it supports itself. So we have to center racial equity. When we center racial equity, it's also important to remember that the affordable housing policies that center racial equity will address housing issues that are not only for Black and Brown residents. One of the narratives around affordable housing is that it's only for poor Black people or only for poor brown people, and it's simply not true. Michigan is a 70% Caucasian state, and we have been organizing with a partner that organizes throughout state, and they've conducted learning and listening circles throughout the entire state in counties that are vastly predominantly Caucasian, and they're still seeing affordable housing challenges with rising rents, with an increase in short-term rentals for use as vacation homes, with the creation of only luxury housing rather than affordable. And so when we talk about the solutions that center racial equity, when speaking to those communities that are predominantly Caucasian, it's important to note that the policies that we're discussing that work in our inner cities, that work for Black and Brown communities, oftentimes also can work for the low-income Caucasian residents that are facing racial injustice. That are facing housing affordability, but we can't make that the focus because then we're not centering racial equity. We have to center the most vulnerable. And then, as you all know, housing is social determinant of health, and then prioritizing that in our policy discussions is very important, and that's where you all come in as allies around housing. So as I said, our policies and plans must center racial equity, and that involves examining where public health professionals actually have had a hand in racial injustice and housing practices in the past. So that includes social housing projects of the past, that includes America's high-rise housing projects. We have public health professionals that were involved in the strategy and creation and running of those concepts of affordable housing in the past, and there was racism involved. And so we, as you all, as public health professionals, really have to unpack that so that you can join in as allies in the housing fight and not help to re-entrench some of those same mistakes from the past. We also have to partner together. So housing advocates really do need public health professionals to assist, and we need public health professionals to make sure that when they're assisting, when they're partnering, when they're allying, they are seeking out those organizations in the community that work on housing that already center people of color. So those are the organizations that already have a racial justice analysis. They have a racially diverse leadership that includes Black and Brown decision makers, and that will help so that we can have successful partnerships. We also need grassroots partnerships. So we oftentimes see very large institutions taking on housing. We see banks taking on housing. We see universities, and we have grassroots organizations working on housing in cities throughout the country that are much smaller, that are on the ground working directly with community. They're doing advocacy and policy. They're also organizing. They're working with direct services organizations, and partnerships with those organizations will give you a much more concrete example of what solutions are coming from the ground. What are impacted residents who will be living in that housing or who will be suffering from affordable housing strategies gone wrong in the future? What do they have to say about your plans, about the direction of your organization when it comes to housing? Those partnerships really create that on-the-ground experience that you simply can't get when you're working only with large institutions. And it's really important to search out and find those organizations and work with them. and seek input from the impacted residents who work with those organizations, and they can give you, as I started out saying, great solutions to the problems. We need funding. Adequate funding is so important. There have been many policies passed around affordable housing, whether it be housing trust funds, and other efforts, and they simply never get off the ground to achieve what they could because they don't have the funding that they need. And so advocating with policy experts, with those grassroots organizations to get funding. During COVID-19, we see that the CARES Act was passed, but the CARES Act failed to mention affordable housing, failed to mention housing as an issue, although it was one of the largest issues that was being faced because with all of the stay-at-home orders, you cannot stay at home if you don't have a home. And in some cases, if you have an unsafe home that has that lead paint, asbestos, other issues, staying at home can really be a detriment to your health. And so having public health officials speak up and talk about the necessity of housing during the pandemic, the necessity of affordable housing, the necessity of healthy and adequate housing and accessible housing is really important. And joining with those local advocates is one way to do that. Joining national policy efforts is very important as well. And a previous speaker spoke about some of the efforts, writing letters to give public comment about the Affirmatively Furthering Fair Housing Act. We work with the National Community Reinvestment Coalition, and so working to strengthen the Community Reinvestment Act so that funding can be provided to create affordable housing in cities that have been negatively impacted by previously either predatory or racist banking policies in the past is really important. So when you see those national policy efforts around affordable housing, I encourage you to connect with the local groups that you will have formed partnerships with and ask their take on it. What's their input? What's their idea of how things are going? And if they think that a public comment should be made and what they think the points are. And I really think that those strong partnerships between public health experts and housing experts will yield results in policy, in increasing political will and increasing funding. And those are the major hurdles that we face. As you see, joining some of those local efforts are really important in joining those national efforts. And that's all. I'll give it back to Adrienne.
Thank you so much, Ms. Kirk. Wonderful job. Apologies for the interruption earlier. I wanted to make sure that everybody saw all of the hard work that you put into your presentation. Expertly done. And I think that one line you said in there probably says it best for this afternoon, that particularly during this year, you can't stay at home if you don't have a home. And I think that resonates throughout the presentations here, particularly for a safe and healthy home. So we're going to talk a little bit now about some additional resources that I'm going to go through fairly quickly. And you'll see some of them up here right now, and they're available on the APHA's website, the Advancing Racial Equity Series Discussion Guide. If this is your first webinar or one of several, this is a place for you to learn more about what you're learning today. The Racism Science and Tools, or the Public Health Professional, is another wonderful resource that we encourage you to take a look at. And I know there's one more that's up there. Excellent. And the publication that Kelly mentioned at the start of this webinar, Creating the Healthiest Nation, Health and Housing Equity. Certainly something that is really delving into all the issues that you have here and things that we will need to take a look at in the future as we delve into really creating equity inside of our housing construct and inside of the systemic engines that are continuing these inequities to move forward. And so we want to get to your questions and answers right now. We know that you have several of them, and I will say to Kelly and Kate, I'm trying to bring some of those up right now in our SharePoint document, and or I can go into the Q&A box and take a look-see. Let's see here. It's taking a minute to load. So what I will do is I'll go into the Q&A box while this is loading in my other system, and it's saying that the server is down. So I know that there were some questions up here about different ways that the four panelists you would recommend taking on the NIMBY issue. How do we take all of the information here and unpack it in such a way that it is accessible to folks so they can understand not just the critical nature that affordable housing plays for people of color, but really I think something that Ms. Kirk said, the importance of access to safe and affordable housing for everybody. I can start with, perhaps start with Dr. Wood.
That's a very big question to kick off with. Try to answer it to the best of my ability. You know, I think thinking about what the root cause of NIMBYism behaviors and calling out what it is step one for folks who are not just looking at this work from a professional lens, but from a personal lens, where you live, how you're engaged with your local your local politicians, your local kind of policies and conversations. When you show up, be that counter voice, and not just be the counter voice, but calling it out as what it is. I think we've gotten so subversive with our language. We know exactly what they're talking about. We know exactly what they're alluding to. And so, you know, putting that truth to power and putting yourself out there, I think is an important part of that to do in where you live, in addition to these additional conversations that folks are having in the professional setting. But I do think being more clear and transparent, and I think the times have allowed that in a way that is maybe a little bit more freeing and liberating for folks to find that voice and speak up. So that would be my response to that.
Right. Thank you for that. And here's a very interesting question for everybody, which is, by calling these communities low income or affordable, are we continuing to create this habit of marginalizing communities by creating a differentiation from them and other communities? I think that's a very provocative question. Dr. Ramirez, you want to take that on?
I think it's a great question, and sometimes we get caught ourselves, right, in terminology that we're constantly using because it's been kind of predefined for us, and for me, this is a new area that we're moving into because I'm you know, we're also seeing that some of our middle income families are beginning to struggle, right, as housing becomes limited, available. People are trying to go back from the suburbs back into, you know, into the cities, so rents are high. So this is, and then, you know, our college students are not making that great of a salary when they're coming out and trying to get their first job. All of these kinds of things are impacting. So it's now a much broader, you know, I think, community that is struggling with housing issues.
Great, thank you so much for that. Yeah, please, go ahead.
Adrienne? I think the point is well taken about words that we use and how we describe communities in a way that doesn't uphold systems of white supremacy or marginalization or oppression. And one, I guess, answer to that I know some organizations are working towards is asking the community, right? I think so many times we have these conversations intellectually and academically, but how do we reflect that back to the community as we're doing this and incorporating them into the process and allowing their voice to come to fruition too? How is that they describe their lived experience in a way that's incredibly valuable? So I think as that kind of language that we use, bringing the community's input on, that doesn't represent me at all, please don't call me, you know, and respectfully doing that, I think centers on, you know, race equity in a way that is equity empowering for that community. So I would just add that as well.
Thank you. I think Ms. Johnson, here's a softball for you, I hope. You know, during the housing moratorium, are landlords receiving rent payments from the government?
That is a great question. And unfortunately, no, the CDC's moratorium does not provide any rental relief or rental assistance or rent forgiveness for renters, and no funding for landlords either, which is why I called it a measure that only delays evictions and does not actually prevent evictions. And so one of the biggest asks that we are pushing the federal government for is $100 billion in emergency rental assistance to ensure that people can remain stably housed and that landlords have funding to cover the cost of operations.
Great, thank you for that. Amina, let me come back to you for a second. You talked a little bit about looking at housing through an equity lens, and one of our viewers really wants to know, how do you begin that work? Like, what are the first questions that a locality should ask themselves as they're trying to do the right thing?
I think that the very first question is, who's at the table having that discussion? When you say, you know, what are we talking about? We're talking about racial equity and we're confused about it. You need to figure out who's at your table that does understand racial equity and racial equity analysis, and make sure someone's there that does understand it, but also make sure that the residents who you're actually trying to create housing and create a housing strategy for are also present at the table. Because you don't have to have a very academic knowledge of it if you have experts at the table that have built careers on this, and we have some on the call that would be happy to partner with organizations that feel that there's a knowledge gap. And that's one thing that we have to look at, is our own knowledge gaps. And rather than trying to do a very quick Google and I'll fill myself in an hour, really bring to the table people who are steeped in racial equity analysis and the pedagogy and the history and the take that it has on housing itself. And then bring residents to the table that are those impacted residents, the Black and Brown residents, the migrant workers who are housed unstably, who have been impacted by COVID-19, who were dealing with the housing struggles before COVID-19. And that can be a challenge, because having those tables, having those discussions and having those individuals at the tables where they're not traditionally will change the conversation. So we have to be open to the fact that our agendas and our discussions are going to take a different shape when we involved those other individuals, but it's going to take the shape that it should. It's going to take the shape that it has to in order for the outcomes to be productive and equitable. And sometimes that means the meetings have a time change. 2 p.m. on a Wednesday isn't when someone who may have a shift in the agricultural field is able to make it to a meeting. It may be a Saturday afternoon or a Sunday afternoon. We may have to shift location because they can't make it to the state capitol. And so being open to including the voices at the table that would be your biggest critics if you do it wrong, I think is an easy way to make a short list. If we get this wrong, who will call us out? And those are the people who are going to call you out because they have a knowledge base to do so. And so bring them into the conversation early and let them help you get it right.
Yeah, absolutely. Thank you. And, you know, it's so interesting. One of the byproducts of the pandemic is forums like this, that it in many ways, it does create sort of a tool that we can use in terms of having a more equitable conversation and getting people to the table. Thank you for that. And what it's just saying that if you're not at the table, you're on the table, I think is the bottom line. So Dr. Ramirez, one for you. How do you address cultural issues to help with housing in your efforts? And how much is the community voice or community clients involved in the work that you're doing?
Very involved. Part of our strategy for Salud America is to really reach out to what we call the Salud heroes, because we truly feel that the solution is in the community. And as just been said by Amina and others, you know, asking the community, what do they think? So we go into the community and talk to them. And, you know, we are part of the opportunity programs that were offered, and we talk to the residents, and you know, what do they want their multi-housing development to look like? And so I think what we really need to focus on is educating our communities that they have a voice, right? And that they can contact their city council members and that they can raise these issues. And as Amina said, they don't have to be the experts, but they're truly living in the situation and can be the best spokesmen for that. And so that's where the culturalness comes. These are things that we want to see in our community that can truly make a difference.
Right. Well said. You know, politics is local. And to the extent that you can get folks to access their elected leaders in an effortless way, it really makes a difference. I know that I hear that in my work daily, that getting those voices to the table are important. Here's a question for all of you, maybe also another provocative one. This particular viewer lives in California, where we all know the housing prices are astronomical. They're saying, at some point, do you feel we need to bite the bullet and realize that we need to increase housing supply to meet demand, but potentially also lower house prices, even if it means reducing the wealth of homeowners? Let's see who's going to take that one on first.
So I'm happy to take a first shot at that. So part of the reason housing is so unaffordable for middle income people is that extremely that extreme shortage of housing that's affordable and available to the lowest income, right? So when we're missing 7 million units of affordable housing for the lowest income people, they are living in housing that they cannot afford, and they are taking up housing, that sounds terrible, but they're living in housing that they can't afford, and they're living in units that would otherwise be available to middle income people, right? And so then when it's a fundamental mismatch that really pushes everybody into housing that they can no longer afford because of this extreme shortage. And so when we start to address that extreme shortage, that market failure at the lowest income end, we'll start seeing people, housing costs even out for people across the spectrum. So I think by addressing that gap, we would see a lot of the issues with affordable housing start to decline on their own, but it starts with addressing that shortage.
Mm-hmm. Anybody else want to take that on? Ms. Johnson, knock it out of the ballpark? All right, we'll keep going. Very good. Community land trust. People want to know what anybody here talk to us a little bit about the role community land trust could potentially play. Is that something you've seen in Detroit, Ms. Kirk?
Yes, so community land trusts have been in discussion in Detroit for some time. We do have one operational community land trust, Storehouse of Hope, and community land trust were contemplated in Detroit based on the history of why they were created, which is actually to provide ownership and wealth generation and stable housing for Black communities. They were originated in Georgia decades ago, and it has been discussed as an option. It has been proposed as an option. There are a number, and I go back to this, there are a number of really sound policy solutions that would address affordable housing. There's no shortage of very sound, proven even policy solutions that would address affordable housing. And I think community land trusts are one of those that provide that ownership, generational wealth accumulation possibility, and preserve, it's continuously and sustainably affordable housing, preserve affordable housing in a community. The question is just, how do we get our policies and our funding to line up with that option? In Michigan, we have some restrictive tax laws that make it very burdensome to create a community land trust. And we also have a lot of hesitancy from both philanthropy and other donors that would invest in something like a community land trust. There's a lot of hesitancy from banks to provide the funding necessary to buy the land, to construct the homes. So it is an option. I think it's a viable option. It's just a question of how do we all partner together to put something like community land trust on the table and get the laws and the policies in place that would make it feasible and sustainable.
Great. Anybody want to add anything on land trust? No? There's a question here, I promise you, I didn't plan it, about the role that public housing authorities can play in really helping lower income and moderate income families evolve from renters to homeowners, and whether they have any programs. And as many of you here may know, they absolutely do. I think that some years ago, Congress passed a law that allowed the value of a Section 8 voucher to actually be used toward a mortgage payment instead of renting a unit. And I have found over the past now 20 years or so, that's been an incredible tool in helping many low and moderate income families begin wealth creation inside of their families. And there's a great program that's called Family Self-Sufficiency. That's one of my favorite programs that exists probably on the planet that helps low-income families escrow what would have been additional rent that they would have to pay, and to create a savings account for college, to buy a car to get to work, any number of things based on the family goal. So yes, reach out to your housing agency, and there's a lot of information there that they can share. I know that we're closing in. I'm going to ask my expert operators, do we have time for one more question, or do we need to begin to close out?
Let's go for one more question.
All right, we're going to be wild and crazy today. Look at that. So there's another question here about ways in which we can move on from this session to actualizing some of the solutions that we want. So this is the rapid round. What would be the one thing, everybody viewing, what would be the one thing that you would want everybody to do when they shut off their Zoom to really advance this conversation? And I'll start with Ms. Wood.
Make sure everybody votes. Vote in your local election, vote in the, clearly we have a presidential election. Vote, make sure your neighbors are voting. So many of the decisions around affordable housing it's a hyper-local policy. We think about it a lot on the federal side, but as Amina had spoken about, so much of this happens on the local level. So, please vote, understand what's happening, understand, what's on the ballot, if there are affordable housing policies. And, if you're aware, how do you spread that knowledge again with your colleagues in your network? I think ensuring that we use this kind of political will to move the needle is really critical.
Great. Ms. Johnson, one thing.
Oh man, just one. I would say get in contact right now with your members of Congress, especially if you live in Kentucky and Mitch McConnell is your senator. There seems to be a big holdup in the Senate on the Republican side about an idea that people do not need more relief right now. And that is demonstrably false. People are struggling and they have the power to do something and are choosing to do nothing. So get in contact with your members of Congress and like Dr. Wood said, go vote.
Very good. Ms. Kirk.
Definitely would echo Camilla and Kim actually. Vote, know what's going on locally, know what's going on nationally, actually get involved, actually reach out when you hear about those things involving housing, both on the local ballot and on the national stage. And I would also say find one organization working on housing in your area, whether that be your community, your city, your county, that centers racial equity, and actually reach out to them and set up a meeting, have a conversation, and start to figure out how you can partner together. That may be a working partnership in the future where you all are meeting regularly. They could seek your support simply on one campaign initiative they're working on for this upcoming election, or it may just become an information sharing where they become a partner in letting your organization know what's going on with housing so that you can support. But reach out and actually try to build a relationship with one housing organization focusing on affordable housing that also centers racial equity in your neighborhood.
Thank you, Ms. Kirk. And finally, Dr. Ramirez.
Thank you. Well, number one, ditto to what everybody said. Really, please get out and vote. It's really important. It's really to mobilize our communities, the colors, that their voice does matter. So that we definitely need that. But also, I just wanted to Amina's comment on finding a local group that you can participate. We had an amazing input on our transit group, so that if there is a group that's focusing on housing, bring your health equity lens to the picture and help those members realize what has happened historically. Many of them don't know. They've been going from one meeting to the next. And so that, that we have a lot of context that we can bring to the table to help them make a better decision for the future.
Thank you. Let's thank our panelists, and thank you all viewers for sticking with us this long. This has been a thrilling. I know I learned a lot from the four of you. Thank you so much for your wisdom and for your amazing data. Please visit the APHA website to learn more, and please also borrow my website, nara.org, if you want to hear more about affordable housing resources near you. Thank you all. Have a wonderful afternoon, and thank you all who are viewers here, and you all have a wonderful day. Take care.
Thank you so much. Take care. Bye-bye.
Thank you.